my name is Lauren Pickeral, and I'm here to talk about communication in healthcare. Do you remember your first trip to the dentist? I remember being absolutely terrified, thinking that this is what my dentist was going to be like. In reality, my dentist met me with a smile, and my fears instantly vanished. Many healthcare professionals enter the field because of their love for science or the human anatomy, but forget about the importance of communication with patients. Studies conducted by the Institute for Healthcare Communication show that the connection that a patient feels with his or her provider helps with overall health, participation in care, and greater adherence to the treatment plan. There are 3 areas of communication in which a provider should show proficiency. First is building rapport. Second is effectively explaining diagnosis and treatment. And third is displaying empathy. Let's dig a little deeper into these areas. So first is building rapport. The provider should make sure to focus on the nonverbal skills which are key to building rapport. They include warmly greeting the patient with a smile. They should entertain a brief conversation aside from the reason for the visit to make the patient feel more comfortable. They should also sit down whenever possible when conversing with patients. Lavery and Ingram conducted a study that showed that the patients felt the provider to be dominating or controlling when standing up when talking with them. They should maintain a comfortable level of eye contact and use hand gestures. Bernard suggests that using hand gestures adds warmth, emphasis, and openness to the message being conveyed. The next area of communication is effectively explaining diagnosis and treatment. There are 2 things that the provider should focus on here. First is to ensure that the patient has a clear understanding of both the diagnosis and the treatment. A study showed that less than half of hospitalized patients were able to name their diagnosis as well as the medications that they were taking upon discharge from the hospital. The provider should also involve the patient in decisions. Another study showed that out of the folks that did not adhere to their treatment plan, 39% of them simply just did not agree with the plan being put into place by the provider. The final area of communication is displaying empathy. In the clinical context, empathy is the provider's ability to understand the patient's emotions. Healthcare providers should listen closely to patients and display empathy by doing the following. First, they should recognize when the patient is concerned or upset and be genuinely sympathetic. They should next always answer all of the patient's questions honestly and ethically. Lastly, they should remember that the patient is a person and not the disease or illness that is being treated. Each case and each patient is different. Remembering that the patient is a human going through a tough time will help showing empathy. In conclusion, there are 3 areas of communication in which healthcare professionals should show proficiency. The first is building rapport. The second is having the ability to effectively explain diagnosis and treatment. And the last is showing empathy to the patient. A healthcare professional's ability to effectively communicate to the patient has a positive relationship with their overall outcome, adherence to the treatment plan, and care. A Chinese proverb states, "No man is a good doctor who has not been sick himself." To me, this means that providers should treat the patient as they want to be treated, not only from a medical standpoint, but also from a personal one as well. Thank you for your time and have a great evening.